So it's interesting because after I returned from my maternity leave, I really kind of started to be more acutely aware that the way Black women are treated within the healthcare system, as it relates specifically to reproductive health, was something that was what I call a silent epidemic. Many of my patients would tell me stories about their experiences, both with birth, but also just with seeking reproductive health care, gynecological services, issues of, when people seek STD screenings, how they're treated, how they're viewed as promiscuous. Um, and just even for transgender women who are seeking gender affirming hormone care, feeling that sense of judgment when they're trying to speak from a place of power about the decisions that they're making for their own bodies. So kind of really hearing these stories, literally on a daily basis and kind of putting the puzzle pieces together from my experience as a birthing person and also my experience as a physician and how we're kind of very much trained to speak and treat people in this cold, calculated way, in addition to really not holding space for individuals' emotions, particularly as it pertains to race and as it pertains to their experience in their bodies. That's when I really understood that there is a problem here, and I really kind of needed to look into this more deeply and use my voice to really amplify that platform. So the first thing I remember very vividly, one afternoon when I went to visit my doctor's office, I wasn't actually seeing the OB that I usually see, who her and I have a good relationship, but she is a white woman. Um, so I was seeing one of her colleagues that day, and I remember she asked me to sit down, lay down, to be examined, and I did. Um, but then it's a very odd thing where she, after she examined me, she's like, okay. She just kind of left the room. And I'm like, oh, hold on, like, I'm still here, I'm still here and I'm still exposed, undressed, with, you know, basically facing the door just because the way that the clinic rooms are structured, it really kind of allows for the patient to be exposed toward the door, which I quite never quite understood. And I'm just kind of there wondering, well, is she coming back? Like, why would she just leave me exposed in this way? I was feeling very vulnerable at the time as well, just because it was very hard for me to kind of get myself up from the table as somebody who's like, 8.5, 9 months pregnant. And I just didn't understand why she didn't explain anything or do anything. She didn't tell me that there was anything wrong, if everything was okay, if what was going on with my cervix. It was just a very, very odd interaction for me. So kind of after peeling myself up off the table, I just kind of left the office and didn't really say anything. Even as somebody as empowered as myself, I still didn't feel enough power to kind of bring that even to a colleague. Like, hey, well, she's technically not my colleague, but like that's inappropriate behavior, right? Like what you did showed an extreme lack of respect for your patient's body, and also just um, made me feel extremely vulnerable. It wasn't that until I really kind of started also hearing stories from my patients very similarly about having gynecological examinations where they themselves felt like their bodies weren't respected and valued, particularly if procedures were painful or uncomfortable or, brought up a lot of kind of emotional trauma for them because, many women and also men and individuals across the gender spectrum are victims of sexual violence, and they carry that and many times with them. And sometimes these examinations can be very sensitive to that. But it just blew my mind that she just like it's like, okay, all right, this is crazy. Just such a lack of respect for the individual. Okay, so it is super, super important for everyone to kind of get involved in this issue. We need all hands on deck. This is really going to take a massive change and shift in the way that we think about Black birthing people, the way that we render care, the way that our policies are really structured in terms of how it is that healthcare in general is allocated and resources are allocated in healthcare. And we really need everyone from every industry to participate.